My name is William Bissett. I'm with Metro Social Services and Strategic Planning and Research Group. We are the group within Metro Social Services that is tasked with putting together this report that you're going to hear about today. You're going to hear a little bit about the history of the report. You're going to hear some really great statistics and a great narrative and story about some of the challenges that we continue to confront and face and address here in Nashville. I first want to say thank you to each of you for showing up. Obviously, as members of our community, being here to hear this information and be part of the dialogue about how we can address some of the challenges we're going to talk about today is incredibly critical. So thank you for that. I just also want to extend a thank you to the West End Community Church for this lovely facility. I've been doing this for 3 years now, and every time we come in here, the staff, the crew that helps us pull this all together is incredibly helpful and great at what they do. I also want to thank Uprise. Where's Courtney at? Is she? I think she's out still doing her great greeting duty, and you probably had a chance to say hello to some of the fine people from Uprise this morning. So thank you to them for all of their help. With that, I'm going to go ahead and hand it over to Abdelghani Barre, our Director in Strategic Planning, who's going to go ahead and get this ball rolling.
Good morning. My name is Abdelghani Barre, and I am with Metro Social Services. And I have been part of the team that has been putting together these reports in the last 15 years. Well, thank you for being here and taking the time to join us and obtain this information about the state of economic and social well-being of the people of Nashville. The Metro Government Charter instructs Metro Social Services to do this report every year. So that is a mandate that we get from the Charter. And we ensure that we capture the most important parts of what's happening in Nashville when it comes to economic and social well-being. At the height of the COVID-19, we decided, because of the challenge at the time we faced it and the inflation, we call it the report, the big squeeze, because it was squeezing the pockets of ordinary households, especially older adults. The year after that, we followed with a report focusing on older adults in Nashville because they are on a fixed income, so they face the most squeeze. But we felt that we need to continue and identify what's making the squeeze so hard for many households. Today, I can comfortably say that after this long analysis, the culprit, among other things, is growth and development. Back when I was young and I was in graduate school studying economics, we were told that once you measure the gross domestic product, as long as it's growing, everything is fine. Today, we will demonstrate that Nashville's gross domestic product has been heading to new level year after year. But as we will demonstrate, the standard of living of many people in Nashville, including 200,000 workers, is not heading up. Therefore, the myth that if you just focus on growth, everything would go well, that's not true. As you will see, growth alone does not reduce disparities. And that's what the focus of this report is going to be. We have the privilege today to have two wonderful individuals who have done extensive work in community mapping and economic development in this community for a long time, who will be presenting their perspective and the analysis that we've done together. But also we have a wonderful panel of prominent individuals in our community. Marsh Edwards of Martha O'Brien, Jim Gingrich, former CEO of Alliance Bernstein, and Dr. Ken Shelton, professor at Tennessee State University, who would also share their perspective of how they see how growth is impacting in Nashville. As you all know that, many of you have participated in many plans in Nashville. You all remember the Nashville plan that was developed years ago. It's a beautiful, wonderful plan, followed by the Nashville agenda. Many of you have participated also the Poverty Reduction Initiative in 2008, where the community came together and set priorities on how to reduce poverty in Nashville. There is, after that, the Nashville Next. And recently, group completed Imagine Nashville. And all of these are wonderful documents that show the way forward. But after looking at the data, things are not getting easier for many households. Today, I want you to think during the presentations and the panel discussion, to think critically and say, what's the problem? And as we blame growth and development, you need to ask yourself and say, who is in charge here? Nashville is a big city. There are many advocates, nonprofits, government. Everybody is working so hard. But at the end of the day, when we measure the standard of living, it's going down. Although the economy is doing very well, and Nashville has become a destination for international tourism. Beautiful place. But still we need to ask that critical question. After the panel discussion, I'll come back here and point the fingers to some of the institutions that we think are not doing their job. So again, I appreciate you guys coming in and joining us for the 15th edition of the Community Needs Evaluation Report. Without further ado, I would like to welcome the Executive Director of Metro Social Services, Renee Pratt.
Good morning. I'm just excited. We've been doing this now for 15 years. And I have to stop and say to our staff, thank you. The work we do sometimes goes unnoticed, and this is the one time that we have to present to you as an audience about the great work of strategic planning and research at Metro Social Services. Before we move on, I'd like to acknowledge any elected officials that might be in the audience. Do we have any with us today? We have one. Thank you so much for being with us today. And also we have board members of the Metro Social Services Commission in the audience. So again, thank you for being with us. As I've kind of referred to one of the CNEs we produced about the economic squeeze, we are still in that squeeze. More and more residents are experiencing systematic issues that are really critical. Providing a synthesis of the many factors that hinder households from experiencing favorable economic and social well-being, this report offers insights and directions that point to a new and different understanding of those factors. systemic solutions in land use policy, business recruitment, and jobs that provide adequate benefits and pay are key components to transforming economic hardships into pathways for sustainable economic mobility. So I hope today, while you're here with us, we show you and provide for you some information that you can carry with you. Many of the people that work with us seek this information for funding, to produce all types of reports, and most of all, to have a collected place where you have all the data at hand. So again, hopefully you will use this information. If our department can help you in any way to provide additional information, please let us know. We are expecting the mayor today, so we're kind of waiting and looking out for him. We're going to go ahead and move through the program, but we might have to stop when the mayor gets here and welcome him. So hopefully you all will understand that. Thank you so much for being with us today. I hope you enjoy.
With that, I'd like to welcome Dr. Garrett Harper from our staff at Strategic Planning and Metro Social Services up to the stage. Is going to go ahead and take you through this year's report. Thank you, Dr. Harper.
Thank you, Will. Thanks to each of you for being a part of today's release of the latest Community Needs Evaluation. This is an important report in many ways, as you've heard, and this year in particular, that's so. Each year, the report draws on a wide range of social, economic, and demographic patterns and trends. This year is no different. However, this year, the theme of the report, growth alone does not reduce disparities, is based on an even wider scope of data, information, and insights. For 15 years, Metro Social Services has produced the Community Needs Evaluation. It's one of the leading examples of continuity of analysis and reporting among the 95 counties of Tennessee and even across the nation. It is one important way that our agency does fulfill the Metro Charter mission of reporting on the economic, social, and demographic conditions of the population of Nashville and Davidson County. A review of information, patterns, and trends over 15 years does lead to some important conclusions for us that we're sharing today. 2 years ago, the report was themed as the Big Squeeze, addressing the economic distress that large portions of Nashville's population were experiencing in housing, food, education, medical care, and other areas. Last year, the report did narrow the examination to the costs and challenges which older Nashvillians face in some very specific and unique ways. This year provides the opportunity to review an analysis of trends over the past decade and a half and to reach several determinations about what those patterns and trends mean for the economic and social well-being of Nashville residents. This report takes up a few central matters. The first is letting data tell the story of what has occurred in Davidson County. This is followed by critical considerations of what those data mean, and finally, the importance of paradigms and a way forward based on that analysis. Recent survey work in our city has shown that nearly 3/4 of respondents across Nashville see a growing divide between rich and poor. As we will see, the number of persons in economic distress is increasing based on an understanding not only of income, but of rapid and steep increases in cost of living throughout Nashville's population. Slide. There. Looking back over the past decade, one sees the number of people living below the federal poverty threshold has not changed very much. Those very low national thresholds of poverty continuously find about 100,000 persons in extreme economic hardship in Davidson County. What we do see is that due to growth and influx of population, and the exit of some of the poorer population, growth has diluted, dispersed, and redistributed poverty in Nashville. There are now new areas of dense poverty in areas where there was none a decade ago. Some census tracts continue to have poverty rates as high as 77%. In other words, poverty is not being overcome, but is being diluted throughout the city due to changes brought on by gentrification and growth. Data tell the story that Nashville has had higher rates of poverty than its peer cities and the U.S. for most of the past decade. In fact, Nashville leads or rivals the pack of peer cities as number one for highest rate of poverty in most years, including the most recent years. 2020 data is not shown here due to the inadequate census data for the COVID year. We also see that Nashville's poverty rate has exceeded that of the nation for every year in the past decade. Who then is left behind? Over 400,000 Nashville workers, half of whom earn less than a living wage. Over 300,000 renters, half of whom pay more than 30% of their annual income to afford rent and are considered cost-burdened. 44,000 single mothers with children, almost half living in poverty. 82,000 public school students, a third of whom are economically disadvantaged. And nearly 100,000 older Nashvillians, many of whom live on fixed incomes and are unable to afford an increasingly costly city. In short, many Nashvillians are left behind. The standard of living is not rising, but is falling for a large portion of the city's population. In recent years, the community needs evaluation has addressed the need to consider poverty not only as applying to persons below the federal poverty threshold. For instance, one person living alone in Nashville would not be considered to live in poverty if he or she earned $15,000 a year. That amount is not even enough to pay for rent in today's Nashville. Instead, the living wage calculation from the MIT Living Wage Calculator provides a far more accurate understanding of overcoming poverty and economic distress in Davidson County. The full data are included in this year's report, which will be released online. In those terms, half of Nashville's earners earn less than $45,000 a year, the median annual earnings. Comparing that against the much higher figures needed as a living wage in Nashville, one again must conclude that approximately half of Nashville's workers are in living wage poverty. Throughout the years, the community needs evaluation has highlighted the increasing gap between Nashvillians' incomes and the large increases in what they must pay for their housing. These data show that over the past growth decade, the portion of households that are cost-burdened has continued to climb, both for the total population and especially for older persons. A recent poll issued by Vanderbilt University indicated that fewer than 1 in 10 Nashvillians believe that they can afford to buy a home in this area. Similarly, this report has focused for 15 years on workforce issues. After a decade of growth, unemployment is often still high and widely distributed throughout Davidson County. In some census tracts, it's as high as 41%. Education remains an area where data illustrate little change over a decade of Nashville's growth. Comparatively fewer public school students in Davidson County go on to college than elsewhere in the state. Even fewer are deemed ready for post-secondary education based on their ACT scores. And nearly 50,000 adults in Nashville continue to lack a high school diploma. Health remains an area where a decade of growth has not altered the reality that 1 in 10 Nashvillians experiences inadequate food and 1 in 10 lacks health insurance. These enduring areas of shortfall in standard of living and quality of life, despite a decade of growth, point to a need to see this economic distress as one that has many facets, none of which can be ignored if meaningful change is to occur. Economic hardship is comprised of deeply intertwined aspects of the lives of families and communities. Further, the worsening economic condition of many households means that the imperative is great to address these needs in ways that are attentive to the root causes of poverty and living wage poverty, not merely the manifestations of those. 15 years of analysis and reporting in the community needs evaluation lead to the importance of taking up several critical considerations. These are matters which are foundational to what Nashville's experience has been. Failing to note the dramatic changes in the overall region over the past 30 years is to miss important points about the social, demographic, and economic realignments that have taken place. In some 30 years, the population of the metropolitan area has more than doubled. However, during that span, Davidson County's share of the region's population declined from 51% to 34%. These significant shifts, all tied to growth of various sorts, have disrupted patterns of work, residence, education, and commuting in complex and challenging ways. Yet, as indicated in the earlier data, growth is not sufficient to address or overcome existing economic disparities. For many, the standard of living has declined as the city's and region's growth has occurred. Recent surveys suggest that only 1 in 10 Nashvillians may support a pro-growth agenda. A reminder from a former U.S. statesman stresses the point that economic growth doesn't mean anything if it leaves people out. Growth that proceeds year after year is likely to create accumulating effects that are not intended or helpful to raising the standard of living in the population. Forbes magazine last year identified Nashville as the U.S. city with the #1 worst commute. Along with that and many other unintended consequences, recent surveys find that almost 1 in 4 Nashvillians does not feel at home in their city. Some of those other unintended consequences include apartment rents that have doubled in less than a decade, home prices more than doubled, gentrification not limited to isolated neighborhoods, but occurring throughout the city, local, small, and family businesses experiencing the pain of sharp increases in lease rates for their businesses, and challenges to public safety that occur with rapid growth. Who benefits from growth? Clearly, over the past decade, higher income households are moving into Nashville much more than lower income households. These figures here are adjusted for inflation across the decade. The influx of highly paid workers and households displaces existing residents, forces housing and other prices up, and creates not trickle-down prosperity for existing residents, but rather an abundance of low-paying service and retail jobs. GDP, gross domestic product. GDP is simply a measure of spending. It is not a proxy for standard of living or quality of life. Davidson County has seen dramatic rise in GDP while real wages have stagnated or fallen for many occupations in the city. Here with just a few examples. For decades, scholars and the media and others have insisted that GDP is not a measure for human well-being. Paradigms. With data telling the story, with critical considerations of what has occurred alongside growth, the embrace of new paradigms to guide understanding and action seems timely. These arise out of the 15 years of data and analysis, patterns, trends that were part of the community needs evaluation. First are overcoming enduring blind spots. Davidson County has experienced historically low rates of population growth for the past decade. I'll say that again. Davidson County has experienced historically low rates of population growth for the past decade. The U.S. Census Bureau reports that Davidson County has over 3,000 fewer residents in 2023 than in 2020. In some parts of Davidson County, only a quarter or a third of students attend public schools. In other areas, sometimes in close proximity, that rate is 90% or more of students attending public schools. The important blind spot regarding poverty: over half of the city's population does live in living wage poverty. And while refurbishing older housing can be less costly than building new, nearly 10,000 permits for housing demolitions have occurred during the last decade of growth. Shifting baseline syndrome. It simply refers to becoming accustomed to a new reality that we once would have regarded as unpleasant or unacceptable. The picture here is of traffic in terms of how interstate highways were once imagined and the reality of traffic congestion today. For Nashville, the issues are of large parts of the population experiencing declining standard of living and quality of life in terms of access to housing, health care, proximity to jobs, all examples of what a generation ago, before growth, would have seemed unlikely or unimaginable or somehow capable of being solved by growth. In situations where elements of growth are not aligned with one another, populations can experience a variety of adverse outcomes. Recent survey data suggest over half of Nashville respondents believe that growth has made Nashville worse. Over the past decade, population in Davidson County increased by only 9% over the decade, while housing units grew by 25%. This raises the question of housing units for whom and for what purpose, and at what point of affordability those are tied to the economic status of the population at the start of the decade of growth. A quote highlights the distinction between development and growth for growth's sake. We'll read this one. We've tried to make a distinction between development and growth. When something grows, it gets bigger physically by accretion or assimilation of material. When something develops, it gets better in a qualitative sense. It doesn't have to get bigger. An example of that is computers. You can do fantastic computations now with a small material base in the computer. That's real development. And the art of living is not synonymous with more stuff. People occasionally glimpse this, and then we fall back into more. In each of these situations, it is important to ask why trends have occurred as they have. The community needs evaluation after 15 years of data and analysis points to ways of asking about foundational explanations for lingering economic hardship across much of the population. Perhaps you've seen this classic image used in illustrating paradigms. If you've seen this, you know the answer. Is it a rabbit or is it a bird? It depends on an ability to see things another way from how we first perceive them. A paradigm for understanding poverty and economic distress in relation to growth patterns in Nashville thus centers on the ability to see things differently than they have been seen, explained, or understood. A theory of change means taking certain actions and then anticipating certain results and impacts from those actions. When those actions do not lead to those results or lead to unexpected results, the suggestion is to alter those actions. In the past decade, Nashville has experienced extraordinary growth as measured by a number of metrics that are shown. At the same time, poverty has remained consistently and comparatively high, as we saw earlier. The largest job growth has occurred in low-wage jobs that were residuals from the high-end growth. Alignment of skills of local residents also stands in contrast to the growth demands of the past decade. And the exit of many struggling populations from the city altogether has been a recurring result. In short, plans and strategies should envision a rising standard of living for many or all in a community. When those efforts do not lead to that, or even to an opposite effect, the change model's actions require reevaluation. This 15th annual edition of the city's Community Needs Evaluation focuses on letting data tell the story of the past period, of bringing forward critical considerations that ask fundamental questions and make clear observations, and on relying on paradigm shifts as a means to view differently what has occurred and is occurring. This way forward recognizes the rising economic distress of many in Nashville, not the 14% at the federal poverty measure, but the half of the population that's living below a living wage earning. The way forward from 15 years of data indicates a need to steer and design growth that benefits a rise rather than a decline in standard of living. The way forward highlights a paradigm shift in how the full range and complexity of poverty and economic and social distress are addressed. And the way forward from data results provides highlights to the importance of an ecosystem that focuses on communities and residences as the priority, guided by values that are the foundation of policies and actions by all elements of the city. And at this point, I'll turn the podium over to Ms. Pratt.
Thank you. We are so fortunate to have with us the Honorable Mayor O'Connell today. He is no stranger to this report. I think he has attended every CNE release that we've had. So that tells you how interested he is in the data and also what it means to the city. So thank you, Mayor, for being with us today, taking time out of your busy schedule. This is the busiest mayor I've ever worked for, but it's been a blessing. So without further ado, Mayor O'Connell.
Well, thank you, Renee, and thank you for this work. I think having the opportunity to reflect on community needs is one of the most important things we do as a city, and it is kind of hard to imagine that this is the 15th annual Community Needs Evaluation release. To Renee's point, I'm not even sure how I first encountered this. I know in my neighborhood of Salem Town, where I've lived with my family for 17 years, we had Metro Action Commission headquartered there for some years. And I think through that engagement as neighbors and starting to form relationships with them and going back to the poverty reduction plan initiative from back in the day that Metro Social Services was a big part of, I just started learning at the community level about some of the important work that was being done. And so well before I ever even thought about running for office of any kind, just as a neighbor and community member, I discovered the work that was happening at Metro Social Services. And beyond the provider level work and the staff level work, including support for seniors, support for mitigating homelessness, and generally trying to provide opportunity where it's most needed. The staff at Metro Social Services for 15 years have been also devoted to helping us understand community needs. And this is so important. So in addition to vital work that serves people, today this is an investigation of vital work that informs all of us about the things we need to do. This work this year is especially important because it happens at a time of continued growth for the city, and I think this overall release is an opportunity to reset our thinking around growth and what it's supposed to do. I think my outlook on this, having just seen the initial releases of information from this report as I woke up this morning, and coming from the Music City Behavioral Health Summit, where we're also exploring a nearby set of needs related to those that we're going to examine more in depth here at this evaluation release. I think this evaluation report is now begging us to reconsider what success looks like and what growth looks like. Nashville's rise, there you go. I hear some applause there, and and I know it's a difficult kind of applause, but I'll talk a little bit about how we have grappled with it since taking office. But you'll see Nashville's rise all around us, from cranes, from lane closures. If you step outside the doors of this church this morning, you know, I think one of the hard parts is the idea that if you're looking up at the cranes that are all around us, you have to be careful not to trip over those who we're leaving behind. And that's the element of this report that is such an important reminder. I'll share with you a few things that are related data sets that I think have a lot of relevance to today's report release. 1 in 4 Nashvillians right now feel like they don't belong, according to Imagine Nashville from its recent citywide values research. Now, it's important to understand that in the context of one of the things that also showed up in that report was overall how important a sense of belonging is to Nashvillians. In fact, it is one of the categories that the group that helped Imagine Nashville study this sees as a stronger element of social cohesion in Nashville. But those 1 in 4 Nashvillians are, I think, it is important to reflect on their needs as a part of this report. More than half of Nashvillians are in living wage poverty, and so we've had higher poverty rates than peer cities in the United States for most of the past decade. And so one of the things that we're looking most closely at as we prepare this budget for fiscal year 25 is knowing that the living wage calculator has shown staggering increases in Nashville, and that we need to follow suit for our own workforce. The college-going rate for Metro Schools graduates in 2022 was well below our neighbors in Williamson County in 2022 as well. And we just talked about this a little bit at the Behavioral Health Summit. Davidson County was the second deadliest major metro in the country for drug overdoses, trailing only Baltimore. In the annual Vanderbilt poll, released a few weeks after the Imagine Nashville results, 92% of poll respondents said they couldn't afford to buy a house in Davidson County. And what that means is they're either going to become cost burden as renters, or they're going to look elsewhere. Since 2020, even as we feel like there is a growth boom in Nashville, Nashville has actually lost 3,725 people to other places. Now, statistically, it's not a huge change, but it's also not growth of Nashvillians and people living within Davidson County. And so this, if we go back again over a decade and wonder what happened to its city, I think the reality is we've grown, but also grown up in some ways. The ideas of a generation ago worked in some ways beyond our imaginations, whether it's the downtown code and the idea that 20 years ago, 20 stories seemed tall for buildings in downtown. But I think now, today, with this report, we need to remind ourselves what growth is for and whom it serves. I think we cannot expect growth alone to be an end in itself, disconnected from how we ensure that all Nashvillians have the opportunity to thrive. And you'll see the cautionary pullout quotations throughout the Community Needs Evaluation Report. And I think our administration is focused on the idea that economic growth doesn't mean much if it's leaving too many people out. I think what we're seeing in this report is that unplanned growth, unattended growth intensifies disparity. Growth is not the same thing as equity. And, you know, this is an interesting dynamic to consider, because we also know that there are ways in which growth also is connected to how we have the resources to serve others. When we look at having a vibrant downtown where actually more people are choosing to live, we have now almost 20,000 downtown residents. When we see that increase in property values there, two things happen at once. It gives us more resources in revenue terms to serve the city, but it also shows how difficult it can be to offer affordable access to an urban center when almost everything that gets built has no affordability in it. And I think, too, about the things that growth offers us and where we should find some things to be optimistic about. I think about the Nashville of my youth, and my brother and I growing up, in contrast to the things that my daughters and I get to experience together. We did not have an art museum, we did not have a zoo, we did not have a symphony hall, we didn't have nature centers that connect us to extraordinary natural resources. There are so many things that are either free or very inexpensive that are opportunities for families that we need to make sure remain accessible to everyone, because that affordable access and those affordable resources are so critically important. And so that is true for Mill Ridge Park, that is true for the climbing wall at Bells Bend Community Center. There are hidden gems throughout Nashville that our growth has allowed us to provide, and so we want to be able to respond to changes in community and in community preference. When we see Southeast Nashville growing quickly, it has been so important to be able to offer the resources of Mill Ridge Park, which has had considerable investment, in which we invested in again this year through our capital spending plan. But in order for growth to be something that provides those resources, that provides equitable access to opportunity, and not something that is only about disruption and displacement, we have to interact with it intentionally, and that's what we're trying to do. We have been focused on financial empowerment, we have been focused on cost of living, we have been focused on quality of life, and ultimately these are efforts to answer the question of what kind of city we want to be and who gets to belong in it. Two of our top priorities at the moment are ensuring that we tackle the cost burden element of living, but that we also maintain equitable access to the city. So I want to talk quickly about the 3 transition committees we established as soon as I took office, and how that their recommendations have shaped our administration's approach, hopefully in some ways preparing in advance for this year's community needs evaluation. We knew from hearing from Nashvillians, and I knew even from serving on the Metro Council in a high-growth district, some of the concerns we were hearing. And so we shaped 3 transition committees around how Nashville moves, how Nashville works, and how Nashville grows. How Nashville moves really is about that access to those resources I shared. If you can't walk to the park or library or school or grocery store that is closest to you, you are experiencing a resource desert. If you can't access your job by commute, when we know that AAA indicates that the average cost of car ownership in Nashville is $1,000 a month to own, maintain, fuel, insure, and increasingly park a vehicle. You're going to have limited access to everything from jobs to childcare to groceries. And so we had a transition committee report that recommended we consider investing countywide in transportation, and that's exactly what we've done. We took that report and immediately began focusing on the work of developing a comprehensive transportation investment improvement program. We released the details of that on Friday. It is awaiting an independent audit and review by the state comptroller. After that, if those succeed, we will take it to the Metro Council and ideally give all of Nashville a chance to vote on connecting this city more affordably with 24/7, 365 transit access to ensure that our second and third shifts participate in commute opportunities, dozen community transit centers located in communities that both need and want transit, and to ensure that you can access the city without having to go into the heart of downtown just to go to some other part of the city. But as importantly, sidewalks at a level where we will, if this plan is approved, complete our entire priority sidewalks network over the multi-year implementation of the program. This is a big deal for access to all of the resources I've listed already. How Nashville works, I think, is often directly connected to what Renee and her team do every day. This is about Metro being a top-tier customer service organization. It is about recognizing that sometimes we are a service provider and we are providing resources, access, opportunities to Nashvillians, but also that as we do so, we're doing it with dignity, we're doing it with follow-through, that tools like Hub Nashville, built almost a decade ago, continue to expand, and that we ease access to those. Right now, if you call 311, we have expanded the call center capacity so that you have call takers able to answer in Spanish or Kurdish to understand things. We've got a single point of entry, and we want to continue increasing and improving access to that. Last year alone, we responded to nearly 300,000 requests through Hub Nashville. And so that 311 number is important, but so is the app that is available on smartphones and the website at hub.nashville.gov. We will continue across departments, and we're so glad that so many Metro departments have leadership that are as focused as we are in the mayor's office, where we've increased our constituent services capacity in responding to Nashvillians' needs as quickly and as thoroughly as possible. Now, the one that is maybe most relevant to today was how Nashville grows. This committee really did look at, I think, so many of the details that are going to be evident in this report. We knew as a result of the Titan Stadium deal that was approved a year ago, and I can tell you how memorable this occasion was for me on the Metro Council as someone who was skeptical of the terms of the deal and ultimately voted against it. Immediately after that vote, in the late hours of that evening, I went to bed and woke up and came to this community needs evaluation. It was the very next day, and it was a striking contrast. What we knew is the terms and conditions of that deal that we would be involved for quite some time in the process of reimagining the East Bank. And that we would reclaim 100 plus acres of public land that would need development. And the good news is we brought on Bob Mendez as our chief development officer in the mayor's office, and he and an incredible team of multiple members of multiple departments in Metro just hammered out an incredible agreement that will give us unprecedented terms for long-term affordable housing, including the very first residential building being all affordable, hitting the entire spectrum of deeply affordable housing to workforce housing, and that every residential project in the first 30 acres of development will have thereafter a minimum of 10%, including some options that are good for families like 3-bedroom homes, which is incredibly important. In addition to that, we had some of the strongest workforce opportunities embedded in this agreement than anything we've done in Metro previously, that will result in federally certified apprenticeships, and ideally achieving our goal of at least having the opportunity for people who build the new stadium and work in the new stadium to at least have the option of living in the neighborhoods that they're creating. But the How Nashville Grows Committee went way past that. It sort of said, yes, do your best work in the East Bank, do the things that will create new neighborhoods with best practices, but you can't stop there. You have to ensure that those practices, the things that we are using to make vibrant neighborhoods in an area that has been surface parking lots for a generation, must then be developed at neighborhood scale in the neighborhoods that already exist around the city, and that we must continue to make neighborhood scale investments. And this is where our initial capital spending plan came into play. Before the East Bank deal was finalized, we invested $514 million into neighborhoods across Davidson County, finishing 3 new elementary schools, completing 2 new fire stations, plowing investment into parks and libraries, which had lengthy deferred maintenance lists, ensuring that we are planning for our future with new parks like Mariposa Park in a part of the city that lacked parks altogether, enhancing the library at Hadley Park as we plan for that, investing in heavy fleet, emergency vehicles, snow plows, tractors for parks to continue to be able to maintain things across the city. And the good news is this and the East Bank development passed the Metro Council unanimously. We hope that this is evidence that the How Nashville Grows Committee is meeting the needs of the community. The overall scenario that we are investing into is trying to tackle everything that this report is indicating are real community needs. Those 3 transition committees have informed our work from the first weeks in which they indicated recommendations. We're very grateful that one of your panelists today, Jim Gingrich, served on one of those committees and helped produce the recommendations. And 6 months in, with work on that capital spending plan, work in the transportation improvement program, which is now finalized, work on the East Bank development agreement, and work in our operating budget to ensure that we are taking the living wage scenario seriously and continuing to invest in affordable housing, continuing to invest in access to this community, and continuing to support leadership in the departments that are closest to the ground for people in need. We are doing everything we know to do to respond, and I am here to make sure that you understand that our office and our administration are working not just across departments, but with partners like so many of those of you who are in this room today, dedicated not just to understanding the information in this report, but like me, working to respond to it every day. So thank you for being here, and thank you for the opportunity for me to be here with you. I look forward to continuing to do this work together.
Well, they say timing is everything in life, and luckily Garrett had just reached the last slide of his presentation as the mayor got here. So thank you again for such great remarks. And again, I've been lucky enough to be part of this team for the last 3 years, and every year I've seen then Councilman O'Connell and now Mayor O'Connell attending, and I think that really says something about the nature of what this report is talking about, and about how we continue to make sure that we have an informed community that has an understanding and is able to analyze many of the aspects and challenges that we see in our community. With that, I wanted to introduce our next speaker. So, residents as a priority, guided by values that are the foundation of policies and actions by the elements of each city. One important way to engage in these topics as a way forward involves engagement of citizen science using community engagement in new and expanded ways. I would now like to introduce my colleague and friend, Dr. Wansu Im, to share some thoughts and suggestions on how this important work is integral to the way forward in advancing the standard of living and quality of life for Nashville. Thank you, Dr. Im.
Thank you. I'm really excited to be here. And then thank you, Mayor, and then Dr. Harper, and then Social Service Metro. Actually, I'm from Meharry. I'm a faculty member at Family and Community Medicine and also Public Health, and also director of the National Center for Community Mapping. But my background is actually city planning. I have engineering background with bachelor's, master's, PhD, all in city planning. And you may wonder what is city planner is doing at the medical school, right? Everything is connected, right? The way we see disease now is not just for any kind of virus. It's what kind of food you have access, right? I mean, he mentioned about the public transit, access to the park, right? And stress, gun violence, housing, everything actually affect your health. So that's what I'm doing at the Meharry. I'm teaching students how everything in the social and environmental and physical environment affects our health, and then how they can use this kind of information into their practice, right? So that's me. Community mapping, engaging and empowering Nashville community. So a lot of people may see this map. This map shows the years of potential life loss before age 75. The darker color means people die earlier, right? So depending on where you are, the life expectancy changes almost 20 years. Can you believe? Right? Why is that? It's because everything is connected, right? Some people, they drink different air, different water, but they got more stress. They don't have access to the healthy food, right? Because of transportation or affordability and all those. So one of the things, I was actually really surprised. I moved to Nashville 2016 from Princeton, New Jersey. I was teaching at Rutgers University. If you look at this Bell Mead, their life expectancy based on the EPA EJ screen, 83 years old, right? 83, right? But you can look at the population structure. 98% of the populations are white. But if you look at the Haley Park, you know what is their life expectancy? I was shocked. 50. Did you know? Right? That's why statistics is important, right? Majority of populations are Black and African American, right? So why is that? We pretend we don't know, but again, everything is connected, right? It's because of certain things that we don't really look at it, right? So this is the main research that I do. I do public health exposure. Basically, people get sick because of social, environmental, transportation access and everything, plus the personal behavior, what kind of food, right? And whether you do exercise. But just because you want to have a healthy food, sometimes they don't have access to the healthy food, right? And also it affects directly to our health, but also it affects our genetic, how our gene behave. It's called the epigenetic. I'm not going to talk about anything about medical thing. How many people went to New York? One of the issue of the New York is finding bathroom. Do you agree? Right? Do you know that actually I'm the guy who created the New York restroom map? Yeah, in 2005. The reason is we went to New York during the Christmas break with my daughters. We couldn't find the bathroom, no line, right? And I have teenage girl. So what we ended up doing was we took the subway, went to the New York Penn Station. I know there's a lot of bathroom there, right? And then we relieve the issues and come back. And then I said, there gotta be some better way because I'm sure that there's a lot of bathroom. What if we can share, right? And collect the information and share this information. That's a good way of citizen science and collective intelligence. And what happened was in 2005, that's when Google Maps started to begin their service. So I was able to create, they called me Google hacker at the time, but anyway. So I was able to do this because Google Maps service provide, and also first iPhone is 2007, and Android is the 2009. You'll be surprised. This one is more powerful than any computers in 1950s and 1960s. Yet we only use it for what? Take photo, social media, right? I mean, this one can really connect us. And then now young generation, even old generation, this become part of their body, right? When I ask young kid, hey, do you know when the iPhone was invented or handphone is invented? You know what they say? 1950. You know why? Because since they were born, it's been always there. So they assume it must be really old technology, right? So, now I understand why that Dr. Harper was having issues. So I was interested in, how to make an app. So, right now, literally, New York University students are using my New York bathroom map and doing the accessibility study, right? So, they still didn't resolve the issue. Oh, wow, I can see it. Okay, so now I can see your frustration. I was thinking, oh, he's not really good at technology. Because he was clicking and going fast and back. And I said, oh my God, it's not. So this is, we call prejudice, right? Without you experiencing, right? Because of the age and all those, you assume that he's not really good at technology, right? So I was featured in New Yorker magazine and New York Times. I still got a lot of interview, even after 19 years. Now let's see whether it works. Okay. Ooh, it doesn't. Okay. Anyway, it's okay. And in 2012, we have huge issues of this Hurricane Sandy. I think some of you may know. We have $70 billion of the damage. And then what happened was all the road got blocked, electricity was out. So there's an issue of the gas station, finding gas, right? It was late October. So the number one keyword, in the Google was where to find the gas. So you know what I did? I was working with the high school students. So we mapped all the gas station. People know where the gas station is, but we don't know whether it's closed or when it is coming, whether they provide the electric outlet. That's cool, right? So we started with the 50 students, and we have 1,500 volunteers through the social media. They keep updating this information. So this was used by FEMA, can you believe? Map created by high school students, real time, was being used by FEMA. And then it was also used by Google. So we have about 1 million visitors. So, and then, actually, next slide is the Department of Energy has an emergency call center. You know whose map they are using to answer? High school students. So because of this project, actually, I went to White House, and then my case was written in the, the Congress and all those, right? So I was known as a bathroom guy, and then gas guy, right? But what I'm interested in is, using this kind of technology that is readily accessible and available, how can we really engage community and then empower them, right? So, it's just a little bragging, WNBC, New Yorkers, and all those. There's not many planner, and then, health person were featured in a regular kind of media, right, with the bathroom story. But anyway, so 2016, I moved to Nashville, right? I got a job at the Meharry. So I've been doing a lot of projects. And the first project was in mapping sidewalk conditions, the safe route to school with the 2 elementary school. Can you see small little kid and their parents? The kids were saying, hey, Dad, this is really dangerous, Can you see, a lot of times we have this statistic and all those, how many times open the community people actually look at, they understand, they participate from their view, right? Look at this. We look at the sidewalk condition and all those. If engineers look at it, they look at it from their height, from their perspective. But if you collect the data from this kid's perspective, kid's view, kid's height, can you believe that it will be more effective and then impactful, right? And then data is more meaningful. And then this is the outcome. We have a website, I can share. So it has all the sidewalk conditions. But from this process, actually parents and kids are changing, and then they are volunteering more, right? And this is how I met Dr. Harper. So during actually COVID, we kind of talked and we said, we should really provide the social service resources, right? Like during the COVID in Nashville. So we created an interactive map, so people can access through the mobile device and all those. And then this is the project that I did with him too, right? Now you understand why I'm so into the social service, because, they have really brilliant people there because they appreciate my talent. I'm just kidding. Okay. So, 2020, we have a Nashville tornado, right? So, it's a photo that I took. And then what volunteer did was that they look at all the damage, right? But by mobilizing citizens, and citizens can do this job much quicker, right? And then, so it shows the damage, severely and all those, so you can see the distribution. But another thing that I was interested in is looking at the post-assessment, disease resiliency, right? I was interested in what's happening, right? Like some people do not have access, right, to fix their house, right? Some people just sold it and move away, right? And some people, wow, this is the opportunity, let's just build a house. So we map and then look at whether it's renovated or rebuilt, whether it's still vacant and all those. And then, it's funny, it's North Nashville. I ask my students, let's just do the community mapping. Let's go, bring the smartphone and let's go there and let's do the survey. You know what is the response? They were scared, right? They said, Dr. Im, but I understand though, not just scared because of the community. They think, Dr. Im, I don't think it's a good idea. We just go to the community and take a picture, right? Then while people do not know who we are, right? And then it could be, not safe, right? So what I did was, if you look at the Google map, there's a Google Street View. Google Street View has all different years of the photo. They provide it for free, right? So if you click a house, you can see what happened in 2020 before and after. Got it? You can see what's happening, and then you can update the data. That's nice, right? So there is really tons of data. I'm going to actually show some other data. Actually, I'm glad that Mayor is staying here because there is some map that I want to show to him. So I hope that just let me know when you leave, and then I can just click, and then show them map, right? So I was involved in part of the Nashville Health Equity coalition. So we are looking at the North Nashville. It's a beautiful place, right? But there's an issue of the high poverty rate and limited access to healthy food and all those. And then really serious issues of the public health, such as hypertension and diabetes. So what I did was when I was invited there, often you have people who are interested in neighborhood and health and all those, but not necessarily have a technical skill, right? And then, I'm a planner with technology and health and policy, a little strange, right? But so I create this interactive map, looking at the public transit access, all the food access, and then also create this map, to show that high blood pressure. Can you see North Jersey? I'm not North Jersey, see, I'm still North Nashville. North Nashville, there's you can see here's the hotspot, right? For the, high blood pressure. Get it? I'm sorry. Okay, so I just need to click once and wait. Okay, and then stroke, right? You would be surprised. I'm going to show you some of the data. There's a vast amount of data available at the neighborhood level, even at the property level and the location. Crime, and then property violations, or even you can see all the house that was being used for the, short-term rental and all those. But imagine everything is got connected, and you can visualize for the neighborhood people, right? They will understand how what's happening in the neighborhood is going to affect their life, and they will try to do something. But what I'm trying to do is really give them opportunity to engage, right? And then have them experience that they can change their community, right? And then empower them. Oops. Okay, so I kind of look at the potential improvement, more accurate local food provider data, enhanced like spatial analysis, accessibility based on the mobility, cultural consideration. For example, I'm Korean American, right? So having Korean grocery is my quality of life. You know, so I want to make sure that we have like Korean grocery. But anyway, food quality and affordability and then education and literacy and engagement. So what we did was with the Nashville Food Project, we did this community mapping event to identify all the food source in the North Nashville, like the community, right? So community people just visit there and then see if they have a healthy food, right? Accessibility, whether they sell egg and fresh food and all those, right? So we look at this. I click once, I have to wait. I have 3 minutes or 30 minutes or 3 hours. Okay. Garrett finished like the 10 minutes before, so give me a little more. No? Oh my God. Okay, 3 minutes. So I have to do it quick. Okay, so we did a survey. People actually have a little better understanding, right, of this, right, after they finish the event. And then, okay, I will just finish. So these are the like common, like extend supplemental SNAP, and then, gentrifications, and then share more. And then I did with the JICA community mapping, right? Look at this. Students. They did project, right? They map all the mosquito breeding site. They said, what did you think about the event? They love it. How much did you know about this event? They said, despite all the class before event, they said they don't know really anything. But after this event, they said they learned a lot, right? They finally learned. So you can see how effective it is. So data at the property level, this is the data that we have. Like in Nashville, you will be surprised what kind of data are there. It's just amazing. Now I want to show you some map. This is a property standard violation and building permit. So you can see where all the building permits happening, right? But you can even see where's all the boarded house, and also here's all the property standard violation. But I want to show you the next map. Residential short-term rental permit, right? Can you believe in North Nashville, there's a tons of it, right? Right? Now we are talking about the housing shortage. Look at the red dot. Can you see the red dot on the map? You know what the red dot means? It's a property, right? Used for the short-term rental, but owned by non-tenant people, right? Who live in California, Texas, right? And then they purchase this property for the what? Investment. No wonder why we have housing shortage, right? Data is really powerful. So there's an additional data need, right? Time needs, data, like detail level of data, localized data, local concern. I need to finish it. This is my housing survey, so I do the same thing for the housing survey, with the using data, and then now I'm using AI to actually extract those information and develop the neighborhood characteristic. I have 30 seconds, so everything that the community people collect, is in dashboards so they can see what's happening. But I want to just show this one, community mapping data, right? Diverse perspective, community perspective, and then richer data, and then increase accuracy and relevance, enhance trust, unique local issues, right? Long-term data collection and monitoring, and also co-ownership. I want to add a co-production too, because city needs a lot of data, right? But these data can be collected by the community people while they are engaging and being empowered, right? So empowering community with data literacy. I'm currently doing a lot of interesting projects, mapping bus stop with like youth, and then measuring air pollutions, with technology. So if anybody is interested in doing any project with me, just let me know. Thank you. I'm done, right? On time. Cool. Thank you.
Wow, being able to see where problems are in our community is so incredible, right? Numbers are numbers, but when you get to see some of those heat maps that Dr. Am was able to put together and clearly identify where we need to be looking in our community, it's really something else. With that, I wanted to be able to introduce our moderator for the day so we can bring our panel up and really help put the report that we put together in even greater context for you. I'd like to welcome to the stage our veteran and award-winning journalist, most recently of Fox 17, our current communications manager, Harriet Wallace. Thank you, Harriet.
Good morning, everybody. Well, let me position my coffee. That is most important. Well, we've heard a lot of really important information this morning, but, you know, when we hear a lot of that data, it brings about a lot of conversations that we've been having right amongst our friends in our offices, with our groups, and as we're developing policy and plans and applying for those grants. So, we're going to have continued discussion with a few people who were so thankful that decided to give us some of their time this morning. So I do want to invite up to the stage Dr. Ken Chilton, Professor of Public Administration at Tennessee State University; Marcia Edwards, President and CEO of the Martha O'Brien Center; and Jim Gingrich, former Chief Operating Officer at Alliance Bernstein. Please give them a round of applause. Help them come to the stage. All right, thank you all so much for coming up here and just hanging out with us for a few minutes. We're going to have a good light discussion. Everything is on the table. Is that okay? It's okay. It's okay. Look, the mayor's gone. It's all right. We can speak freely now, right? You can say everything that you say in your meetings like it's a safe space. It's a safe space. We're going to get it out there. All right, so let's jump into some of the stuff that we've been seeing in this report. Everyone got the 4-page, the twofold here. Just a show of hands. Was there anybody shocked at what you saw in the report? If you were shocked, raise your hand. A few of you were? If you're like, been there, done that, try to tell them, I bought a poster, a billboard and all that, raise your hand. Okay, very good. All right, well, let's jump into it. Is there anything, let me ask you all, let's start here. Is there anything to you all that, and this is for everybody, that shocked you, or perhaps what stood out to you the most that you saw in this report?
Probably not, because I do a lot of data analysis that looks at a lot of these issues. However, I want to tip my hat to the folks who put this report together. A lot of these reports are about 300 pages of data tables, and they broke the mode by actually taking that data, boiling it down to essential elements, and weaving it together to tell a story. And it tells a story about a Nashville that does an outstanding job of planning for tourists, as Dr. M pointed out, with the short-term rentals. If you look at the hotels and you look at the downtown and the cranes, but doesn't necessarily do a very good job of planning for the people who work to make that economy function well. So I think today we'll probably add some meat to the bones of that discussion.
What about you?
So I think from the perspective of Martha O'Brien Center, I mean, this is confirming data. I mean, we knew that we had increases in those families that are living in that very large belt of people above the poverty line. We're known for serving people below it, those 16,000 families that the data tells us about. But I think that what we saw through the COVID was how vulnerable our city is. We saw people go broke in 2 weeks. We saw people go broke in 4 weeks, 3 months, but it was quick. And people that had never come to Martha O'Brien or had only come to donate food had then come to that line where they needed cash, they needed food, they needed, if they were in the tornado in East Nashville and North Nashville, they needed more than that. So I think that this is confirming data. I think that the concern is that there's growth in areas that we don't want to see. We want to see 17-year-olds and 18-year-olds leaving our high schools without the ability to earn a living wage because they didn't graduate, because they graduated without a plan and didn't get that second degree. I think the other thing that is very concerning from our perspective is that we are the cash cow of this state. And we are trailing, not leading, but we are trailing in some major indicators of the well-being of the people of Nashville.
So, in addition to being Chief Operating Officer of Alliance Bernstein, one of the things that I did was run for mayor. And what's in this report largely encapsulates why I did so. You know, we talk about growth, and if you look at surveys like the Vanderbilt survey or Imagine Nashville, we want to blame growth for our problems, and it certainly brings real challenges. But what growth does bring is an opportunity. It grows our resources. Our metro budget today is dramatically higher than it was 10 years ago. On a per resident basis, it's 65% higher than it was 10 years ago. That is well in excess of inflation. And yet, we are confusing the means with the ends. We are not measuring what is the most significant thing that growth should be delivering, and that's what this report does such a great job of. Why is it that a city like an Austin or a Charlotte, and we've experienced similar growth as those cities, have a poverty rate that is a third less than ours? Why is it that more than 1 in 5 kids here lives in poverty? Why is it that nearly 1 in 5 kids isn't graduating from high school? Why is it that Davidson County, despite the wealth that exists here, is ranked 88th out of 95 counties in Tennessee for child well-being? Why is it that in Nashville, our intergenerational economic mobility is way behind most cities in the United States? So if we're trying to change those statistics, we better figure out why. And the only place that can do that is leadership out of metro government, and that's what we need to be doing.
Jim, you touched on something in your remarks there when you talk about our peer cities, and we see this in the report. Nashville has had a higher poverty rate than its peer cities and the U.S. comparatively for most of the past decade. In 2022, the poverty rate 14% for Nashville, 12.6% for the United States. What are other cities doing that Nashville isn't doing?
I don't know if I have all of the answers, but I can tell you what I think some of it is. We need to be really intentional about understanding what are what are we actually seeking to achieve, right? Are we seeking to grow jobs? Are jobs and economic growth a means to an ends, which is a better life for the people who live in Nashville? 1. 2, to the extent that we are not achieving what we want to achieve, do we really understand the root causes, and have we put together a comprehensive plan to deal with that? And then do we stick to that plan over a period of many, many years? You know, my perception is that, Marcia and I were talking about this beforehand, is we say to Marcia, you're doing a great job. Here's some money. But do we have a comprehensive plan to, for example, on the issue of youth, to change the metrics that I just talked about? I don't think we do, and I do think the other cities do a better job of that.
And I want to open it up to our other panelists. Anyone want to chime in on that? What is everyone else doing that Nashville isn't doing?
I think that we have grown with kind of an uneven agenda, and I don't put that on any mayor or any councilman. But I think as a city, we have, for many, many years, we have been trying to attract headquarter companies, like my good friend here, and that's great. That's not wrong. That's not the wrong kind of growth, but it is one slice of the growth that we should have been trying to attract. We did not attract companies who had entry-level jobs. We did not require companies to build apprenticeships so that people could come and rise up to that skill level. We don't have a jobs problem. I think that our perspective is that we are very caught up in being the it city. Whether we say it anymore or not, we still have it up rolling around in our heads. And what we need to really be is we need to be the place where we have this incredible opportunity equity that is functional. You can see it, you can touch it, you can hear it over the radio, you can hear it on the media. I think that other cities have been more focused. Denver is a good example, where they have been more focused on how do we include everyone in the prosperity. And yes, they have incredible rail line. If you've been to their airport, you know it's halfway to Kansas, so they needed a rail line. But it has provided opportunity. Those infrastructures are important, but they also, in Jefferson County, required everyone, nonprofits, cities, county money, and they said, come together, we're going to change the employment opportunities in Jefferson County. And you're going to put your money on the table, and we're going to redistribute it. And if we need a waiver from the federal government, go out and get it, because this is the way it's going to happen, because otherwise we can't help people take advantage of what the Denver area provides. So we just haven't had that conversation, and I think we haven't made that commitment, but we can be the city where it is a place where we solve for it. That's my concern. I came to Martha O'Brien from Charlotte in 2001. And I think that what I see is that we are not solving the people's problems. Transportation is one of the people's problems, and so we're about that right now. That's great. We have food deserts in the same places in 2001 that we have today. You're telling me Nashville can't solve that? No, we can, but it has not been our priority. It has not been our conversation, and that has to change. We have to change the conversation among the people of Nashville, and the people of Nashville need to know that our low-wealth families are not just sitting in some 900 units in public housing. It is 40 to 50% of vulnerable families in our city. That changes the motivation of Nashvillians to do something about it.
And I would just add to that, I mean, poverty is a function of wages and income, and the nature of the Nashville economy, especially downtown, has been focused on service and accommodations, and that attracts a low-wage base of workers or types of jobs. The other thing at the state level, you're starting to see pushback. I think the movement in Chattanooga with the UAW is an example that workers are starting to say, this value-free development where an employer comes in, they get subsidies without necessarily giving back to the community in terms of livable wages and sustainable employment over the long term is no longer acceptable. So pushing back a little bit on the value-free type of development, and again, I want to tip my hat to the folks in Metro Social Services for actually questioning this growth is always good mentality, when the data clearly shows without some planning and without some type of organizing metric of how do you benefit from a new stadium downtown? How many of those people that are referenced in this report can afford a PSL? How many of those can afford a Taylor Swift ticket? How many of those can afford to go to a Predators game? We are focusing on the top 20% and ignoring a lot of the people who make this whole economy function. So again, it's attracting companies that will pay livable wages and won't fight against attempts by workers to have a livable wage.
Marsha, you hit on something pretty specific that I think answered, I know one of the questions that I had, but I think helps to answer a lot of questions on a lot of folks' minds, because we always talk about jobs, growth, these companies, everyone has their headquarters here, their regional headquarters, they're opening here. I mean, so much. So how is it that, and you explained it, we have all these jobs coming, but we still have a significant wealth gap. And then one of the other stats in here explained how many are living in the poverty range when they're working. But you mentioned it, a lot of jobs, but they're higher level jobs, yeah. And we need to balance that out. So let me ask you and the rest of our panelists here, smart growth, balanced growth. We hear those terms a lot. We have a room full of stakeholders. Where is the break in the gap? Because we've got organizations, departments, boots on the ground, brains in the boardroom, We've got leadership in the community, in city government. Where's the disconnect? Because there's no balance. And how do we get that balance?
So I think that we don't have a jobs problem in Nashville. We have plenty of jobs and we have good jobs. But our Nashvillians have not been able to compete for those jobs in general. I think we do have to change our mind about people that are in the lowest rung of our economic ladder and see their potential. I think that does require much more extensive job training opportunities that can be done in collaboration with companies and unions and many, many others. I think that we also have to communicate where the opportunity is to people and where there is an opportunity to open the door. The problem with the families that we serve at Martha O'Brien is they don't know where the doors are. And so, I mean, the mayor talked about 311. I'm sorry, but that's not anywhere near enough. We need a central location that is, and it doesn't have to be physical, but you need to be able to find childcare there, family supports, training opportunities. Hiller and Lee companies had an apprentice program that they put together because they were so desperate for employees and people that could do that work. Nobody knows about it. You know, if this sounds familiar to you, we do this for entertainment. Because what do we want? When people come to our town, we want them to have a good time. Well, I want the Nashvillians of this city to have a good life. And we are not communicating with them and giving them opportunity in the same way. It's not intentional. Everybody's doing good work. But the reality of it is that we need to see Nashville from the perspective of those who are earning the less. We have a skills gap here. What are we doing to fill it? Because I can tell you, the people will not disappoint.
Thank you. Anybody else want to chime in on that? Or did Marcia take care of it all? She got it. All right. Well, you know, to listen, we're in church, so I'm going to quote the Hood Bible. The math ain't mathing, okay? Because when you talk about all the jobs, but then so many people still in poverty, that the growth, you know, calculation is just not adding up. So while we're in church, if anyone wants to say amen on this next question, feel free. This is a safe space, okay? It's morning time. Let me ask you all this. Because the mayor, when he was here this morning, said, you know, we're looking at what growth is for and who it serves, right? And this report clearly explains who growth is serving. You all in the audience know who growth serves. But here is my question. Why is growth in Nashville not serving those who are in certain income brackets or zip codes or neighborhoods? Why is growth only serving, or mostly serving, according to the data, those who are in higher income brackets, who have more education, who have more access to the jobs that come in here?
Has to do with capital and the ability to invest and own. And over the past 5 years, there's been the biggest transfer of wealth in the history of the United States. If you were a homeowner in 2018, your equity gains have dwarfed previous generations for doing nothing other than having your name on a deed. It's not just that. You worked hard, I know all that. I'm not trying to discount that. But the cost of housing here has benefited real estate agencies, developers, businesses that finance development and such. And I was looking, when I came here around 2010, a little bit later than that. If you go back to 2010, you look at incomes. They've actually gone up. Growth has brought increased wages across the region. I looked at about 13 counties, including Davidson. Income has grown about anywhere from 50 to 70%. However, the cost of a house throughout the region in different counties has gone up by anywhere from 140 to 180%. So when you plot that out and look at the spread, the ratio between housing prices and income, that went from about 3 to 1 in most of the counties in this region to over 5 to 6 to 1 today. And that's just not sustainable. You see it showing up in property deed records. The number of LLCs, and that might be a project that we can collaborate on in addition to short-term rentals. But the LLC-ification of the housing industry, there's all kinds of property owners here in town who don't live here. They're not Nashvillians. They're not sponsoring little leagues. They're not engaged civically. They are absentee landlords who are just benefiting from the growth that's happened here. And they've targeted Nashville and the Nashville region as an area, as a profit center. There are 13,000 plus homes in the Nashville region that are owned by Wall Street companies and private equity companies that are no longer owner occupied. They've been converted to renter occupied. And these issues are really hard to solve. They're happening in other growth areas. But for someone who's working, making $20 an hour, they can't afford to play in that game. They can't compete with that type of money. Those companies can make all cash offers on homes. They can close within 2 or 3 weeks. And they can make decisions to buy using algorithms within 10 minutes of a house going on an MLS listing. So the market is not, there's not a market equilibrium there in terms of pricing and such, and it's not competitive for Nashvillians.
Look, I was going to say, just to build on what Ken was saying, housing is a big piece of the puzzle, as to maybe why we are seeing what we're seeing with our kids. You know, I can remember a conversation with a teacher where the teacher was telling me that the kids that struggle most in his classroom were those that kept moving. And inevitably, because they were moving because they had to, because the price of that housing kept going up. So the question is, again, back to how are we going to change things, is an example, what is going to be our strategy in terms of housing as a city? You know, there are places in the country, like Montgomery County in Maryland, that are doing some really innovative things out of that county to build housing. The mayor of Atlanta has said he's going to get 20,000 units of housing built by the city if he's in office for 8 years. And he's not just talking about it, but one, he set out a metric. He's saying, measure me. And now he's got programs underway to deliver on that. Again, I don't think we should be making this about growth versus the people here. The growth gives us the resources to do those types of things. Our problem is that we are not planning that growth and using that growth to deliver for the people who live in Davidson County.
I was at a conference in Boston a couple weeks ago, and the national data on apartments being built across the country is that 2% are affordable. Now, 2% are affordable across the country. So in a city like Nashville, I mean, we're so far behind the 8 ball, it's going to say something dramatic. It's not a small, incremental incentive to developers. It can't be done solely by MDHA. The reality is we have to say, we're going to solve this. I'm going to sound like a broken record, I think, up here, because it is about investing in people, and it is about going after a problem and solving it. We are now a child care desert. Can we isolate some capital funds out of our budget to say we are going to help people open child care centers because we need them because people can't go to work without them?
And to pull on a word that you had used, Jim, strategy. When we talk about the development, the growth, and the space that we're in right now, and the discussion talking about housing, okay, let's say we fine-tune the strategy, right? But then what kind of teeth can we put to the strategy? Does it look like maybe developers, when you come, then you must, if you're in a certain zip code, or regardless where you develop, you must include, a grocery store, so it's not a food desert. It must include, I don't know, a public transportation depot if there's not one already. Does it look like when companies come here that you must provide childcare or whatever it is? And I know we've had the community benefits agreement, things like that, but I'm talking about some hardcore, this is in your move to Nashville contract. And you know what happens when you sign the dotted line if you do not follow suit. How do we put teeth, requirements on the table, and teeth behind it as far as a strategy to solve these issues?
If we're talking housing, again, if you look at something like Montgomery County, the innovative thing they've done, which is now going to be replicated, is in the process of being replicated elsewhere in the country, is that they are using the bonding capacity of the city to build, in many cases, mixed income housing, because you're able to, and I don't want to get too technical, but your ability to have a lower cost capital structure because you are a county or a city relative to private developers, and you do that, and it could be, in Atlanta, they just put out the first RFP on public land. Look at what we're doing on the East Bank. That housing is going to remain affordable forever because it is on city land. We could be doing that much more aggressively across the city. And again, we have the bonding capacity. What Montgomery County has done is recognize these properties throw off income so that is more than sufficient to pay the debt on the bonds. So we just need more creativity, and we need a plan, and then you have to execute on the plan. It's about the resources. We have resources. As I said, our budget per resident is dramatically higher than 10 years ago. Why aren't we making progress?
But before you speak, I just want to add to that, because listen, we've got the cameras rolling. Channel 3 is here, so I just wanted us to go on record. If your organization can be a resource for the solution, if your organization is creative, has creative people, just wave your hand a little bit so we can see. If you can be a solution to the issues that we're talking about, if we need to call somebody, email somebody, you're here. All right, thank you so much. Go ahead, please.
Yeah, I like those suggestions. A lot of it has to do with financing, and that's where politics comes into play. At the federal level, some would categorize our government as dysfunctional. At the state level, folks might categorize that as anti-urban. So we have to do it locally. And because of that, the resources are much more limited than they used to be in the 1960s, where you had a very active federal government investing in public housing and things like that. So it will require a lot of creativity, as Jim referred to, which means you're probably not going to add tens of thousands of units in a very short period of time. It's got to be a long-term situation, but we need more coordination among the various agencies that are involved. And unfortunately, again, most of the incentives for development are targeted towards the investor class. If you look at the most recent federal legislation was the opportunity zones, and that gave credits to investors, not the people who live in the community. And that's a situation that's just hard to fix. And Nashville's not the only city that this is happening in, so it's not restricted to a lack of leadership purely in Nashville. These are national and even international problems. Yeah.
Yeah, I was going to say, look, I don't want to be too negative. I mean, but I do think this is more than just giving a few more dollars to the Barnes Fund. The city is doing some interesting things. I see Mick over there. I'm involved in something called the Catalyst Fund that's being set up at the Community Foundation that's designed to provide transitional loans for those building affordable housing. But again, there are things happening elsewhere in the country that we need to be paying attention to, because ultimately, the great thing about doing something from a city standpoint is you can ensure that housing remains affordable in perpetuity. And that isn't always the case when you're talking about private development.
So how do we get to that place where we're watching what other places are doing and say, man, that would be great here? We have, again, a lot of wonderful minds in this room alone who have plenty of ideas, I'm sure, even just on this stage. How do we get to that place where we say, okay, this is how we're going to corral everyone's strength, talent, and resources and move forward? Because we've got nonprofit, we've got our community groups, we've got our metro government, we've got our private companies. how do we corral all of that? Because we can talk solutions all day. Everyone has the best idea, right? But how do we come together and finally actually make that happen? What does that look like?
I think it means we need to change the conversation in Nashville. As I said, I think that there has been a perception pre-pandemic that the poor will always be with us. I don't know who said that first, but I wish the Bible hadn't repeated it. I think that we need to change the conversation about who we want to be and what we want to be proud of. And I think that goes to saying we want to be the most inclusive community that has the most bridges. We remove most of the rocks to people rising. That's what we need to be known for. I think that's what Nashvillian would be proud of. You know, there's a lot of Nashvillians not too proud of Broadway anymore. So why don't we redefine ourselves as this incredible place? I'm not a big fan of another plan. I think we need to identify 4 or 5 things that we're going to solve, and then we just start hitting them one after another. And you could say transportation's the first one. We're going to solve that. When I came here in 2001, the first meeting I had with residents in Casey Homes was the jobs don't come to us. We don't have private transportation. The bus doesn't go to the jobs unless you want to wash dishes or clean rooms downtown. So we're working on that one. That's good. But I don't think that we need, you know, everybody can stand on the corner and point to the problem. Then we talk about how big it is and where it is. And we need the data, yes, but we have it. It's time to do something about it. Say these are our top 4 programs that are going to help people rise in our city, and go after that.
Well, one of you are going
I agree.
No need to pontificate. Just one word answer. Agreed. Done. Let's talk a little bit about traffic. Everyone's favorite thing. I was sitting in traffic on my way here this morning. It's an issue. It is an issue. Pretty much every corridor of this city. It's only getting worse, seems like. There have been some advances, some adjustments. You know, there's a major project underway right now, like in the Donaldson area. But let's talk about that. Because when we think about the folks who have to ride the bus, you just mentioned jobs don't come to us. We've got to get there. When they've got to get on the bus or get a ride with someone, or they're driving themselves, don't have a lot of time. Is enough, do you think, being done maybe on the federal level to solve some of these traffic woes? Or listen, let's just leave the federal piece alone. Let's bring it down, you know, locally, you know, from the state level.
At the federal level, no. State level probably doesn't have adequate funding. But we had a referendum a while back on transit, and it failed. And you saw that to your last question about what can we do, an idea to increase density to hopefully get more units to bring down prices on housing. The NIMBYs came out. People don't trust government to solve problems. We've been told that for the past 40 years, and we defund government, and lo and behold, government can't solve problems. It's a self-fulfilling prophecy. So really difficult. I mean, other cities, Minneapolis, went ahead and pushed forward for, now they already had light rail, but for upzoning, allowing more density along high transit corridors. And when I hear people talk about that in Nashville, we have high automobile corridors, but we don't have the mass transit to move people where they need to get to when they need to get there. And absent that, densifying certain corridors is really difficult to do, not only from a funding, but it just doesn't make a lot of sense. It works in Europe because you've got, 10,000 people per square mile living close together, and it's functioning. We're very spread out. A lot of people want to keep their single-family residential zoning, and any attempts to kind of threaten that are interpreted as here comes the government to take my property and to ruin my quality of life. So we're in a really bad spot, and transportation planners have shown that just building more roads doesn't solve it. It's the equivalent of unbuckling your belt one notch and continuing to eat. And that's what happens when we just add another lane every 15 years. It eventually gets full again. So it's a tough problem. Again, not Nashville specific, but Atlanta, Charlotte, you name it.
Jim, were you? I mean, not that you have to.
I think this is mainly the problem of the middle class. The people I serve are not driving down 65 from Williamson County. I think that there's an opportunity to do something better on public transportation, and we'll see what our city says about that. But I don't think that, other than public transportation, that is keeping people from the very lowest rung of the economic ladder from rising. It's not the roads, it's not the traffic. It's just being able to get on a bus and get to something that pays $18, $20 an hour. I think that it bothers us because it's a quality of life issue. And if we want Nashville to be, I moved here from Charlotte. Charlotte was an hour across the city any time of the day when I left in 2000. So it has an impact on people wanting to live and where you live. But I don't think it's if we're really going to focus on these people that we know and love and want to see their dreams achieved, traffic is low on my list.
So I guess I would say a couple things. One is these are complicated issues. I think, Marcia, one is what are we seeking to achieve with transit? Because as you said, for folks who are, if we really want to make progress on some of the numbers that are in this report, it's how do I get those folks to a job? Now, our traffic issue, in many cases, has to do, again, with something like affordable housing. I can't afford to live in Davidson anymore, so I live in Sumner County and I drive in. But that is more of a middle-class issue. And I do think, ultimately, it comes down to what is the major priority that we have as a city. If there is a trade-off that we all have to spend 5 more minutes in traffic to make progress on what's happening with our children, I personally would be willing to spend 5 more minutes in traffic. So I do think this all comes down to what are we seeking to do? How are we measure? What does success look like? And how are we going to measure it? And do we talk about that? As Marcia said, what is our conversation?
And as we start to wind down our panel discussion, just very quickly from either all of you or if one of you all wants to take this, excuse me, talking to our audience out here, our stakeholders in the city, any words from them as far as maybe how they can be even more included in the conversation and in the work that is being done and needs to be done? Any words for them? Quick words.
So I would just say, look, a lot of our partners are in this room. In some ways, we are talking to the choir here. We're preaching to the choir. But I think it is, there's things Martha O'Brien does that are important, but it's not on those top 4, okay? It's not on those top 4 that would change dramatically the opportunities for low-wealth families. And so I think if we all, as practitioners and people involved in this issue, people that are leading these conversations in churches or in government, if we can agree that all our issues aren't going to be at the top of the pile, and then we can focus on that, I think this city has a history. We've done the right thing before. When the 5th students knocked on the mayor's door, things changed. That is to our credit. We've also done things and ignored things that we shouldn't. And I think part of it is understanding that this is not a small percentage of the people that live in our city. More and more people are vulnerable in 2 weeks, 4 weeks, 3 months. And what we need to do is we need to build those opportunities for people. And I think that all of the people in this room that care about this, we need to be singing not just the same song, but the same verse.
Open the doors of the church on that one. That was good.
I would just add one thing, and I tell this to my students. If you want to know how to deal with poverty, talk to someone who's struggling with poverty. If you want to know something about addiction and substance abuse, talk to people and understand the problem. You don't need a PhD from Tennessee State to tell you how to do that, or a PhD from Vanderbilt or wherever. We've got plenty of those throughout to plug in at a grassroots level and be the drivers of policy as opposed to policy's purported experts.
Would you care to add anything, Jim? If
Look,
not,
the only thing I would just leave folks with is we're in a very fortunate situation today as a city. You know, if we had not grown over the last 10 years and we were sitting here with the same budget that we had 10 years ago, or God forbid we had the challenges that some cities have across the country that are actually shrinking, the question for us is, what are we going to do with the opportunity that we have? Because we have an opportunity unlike the large majority of cities in the country. And are we up to that challenge?
all right. Anyone have any closing remarks as we close out the panel, or have we said it all and enough? We're good. All right. Well, as the wife, as an associate minister, I'm going to give the benediction for this here panel. May success shine upon you. May the gods of equity be with you at all times. Now, we do thank you all so much for taking time out again for this panel discussion. Thank you all for listening. And now I'm going to turn it back over to our Master of Ceremonies, Mr. Will.
I'm going to do one last introduction. We'll get you out of here on time. Again, I really appreciate everybody's willingness to come out and hear from us. It's obviously a great topic. Thank you again to the panelists. One last round of applause, please. Thank you. And with that, I'm going to go ahead and hand it off to our Director, Abdul Ghani Bare, for closing.
I promised you earlier that we will see what we think about growth, and I think you agree with me that growth is not a bad thing. I agree with Jim, but it has to have a purpose. If the purpose was to reduce disparity and increase standard of living, that has not happened. And the panel was so kind to say, there are these things that we can do. But I'll give you one example. What needs to happen in Nashville? Metropolitan government of Nashville and Davidson County is the largest stakeholder in this county. It touches the lives of people through public safety, education, economic development, parks and recreation, social services, all of these things. It spends about $4 billion, as Jim said it. But I can say Nashville is 60 years old as an organization. It has never been revisited after 1963. Do we need to have the type of institution it is today, or we need to reform metro government? Who represents the citizens when we're talking about economic development? Does anyone know here? I wasn't there when Jim was invited to come to Nashville, Alliance Bernstein. I have no idea what the discussion was all about. But if I were sitting there, the first question I would ask would be, who do you intend to hire? If you don't have the skill sets that you're looking for, how can we get there if we don't have it? I think we lack an institutional capacity in Nashville to address these issues. As we said, we have many plans. We have expertise in this room, everywhere in this town. I think the first first thing that we need to ask is, what does it take to reform metropolitan government of Nashville and Davidson County? It impacts our workforce training. It impacts about our transit. Think about it. Earlier, we said over 9,000 properties were demolished. Someone gave the permit, the developer didn't do. Have they asked you the proper question? I'll give you 3 examples in the last few years. Do we all know River Chase Apartments off Dickerson Road near the old Salvation Army? There was a whole discussion. We gave data about who lives there, what's their median income, all those kind of things. We were told the developer would factor all of those into the discussion. Well, the result, we know that. Unlikely anybody who was living there with a Social Security income coming back there. The second example I would like to give you is Belmead Plaza. Even we think people in Belmead have influence, at the end they lost it. The developer won and is going to do whatever they wanted to do. In Bellevue, we heard the whole community came to the city council saying that we don't want that development. At the end, the developer won. At some point, we need to ask and say, Nashville is a great place. I agree. The economy is booming. We have wonderful universities. I think the first thing that needs to happen is re-evaluate and say, Metro, do you have the authority? Even when you're giving permits, believe me, every department follows what the charter says, but the charter is too old. It needs to be revised. The Metro Council is a wonderful entity. They don't have even one single staff that can do research for them. They have to take care of their families, but also they have to do. What I'm saying is that Metro is 60 years old. It has never been revisited. Dr. IM can map tomorrow all the property owned by Metro government that are dilapidated, old school, nobody is using it. The city can give that to nonprofits that develop affordable housing. But who is going to make that decision? We lack the institutional capacity to do forward. So what I'm suggesting is Metro needs to do 4 main things. Number 1, it needs to reevaluate its relationship with nonprofits. My friend and colleague, Will Bassett, came from Phoenix, from the mayor's office before he came to Nashville. He shared with us that in the mayor's office in Phoenix, in the Office of Economic and Community Development, they have 60 employees. Metro Nashville, 1 employee. You can see where the emphasis lies. Again, that is how Metro was founded 60 years ago. The world has changed. Metro needs to change it. So the way we interact, the way we recruit businesses, we also need to engage nonprofits, provide them the data, all kind of things they need, because they do a tremendous job in this community. That's one thing. Second, small businesses. Those 60 people, half of them were in charge of promoting small business. I come from immigrant communities in Nashville. When they want to open a business, they have to go to water, codes, fire marshal, health department. It is so bureaucratic and complicated. Does Metro government have Office of Small Businesses? You ask yourself. It's not that we cannot have it. Again, the priorities of 1963 is Nashville. For example, we have 2 tiers of property taxes, as you all know if you pay it. General services, general district, and the urban services. After 60 years, why we still need Nashville? ENIAC is no longer a rural area. Who is asking that critical question? That's what needs to be asked. The other thing is that our relationship with the state of Tennessee, whether we like it or not, a lot of federal resources come through the state. Nonprofits can benefit, Metro can benefit from that in terms of workforce, small businesses, infrastructure, all those resources are determined by the state. Just they don't like us, we don't like them. There has to be, in the African culture, where I come from, there is a saying that says, when two elephants fight, especially in East Africa, too many elephants, it's the grass that suffers. When they fight over the grass, because farmers who have livestock, they want to see their cows grazing the grass. But elephants don't care, they don't see. So when they fight, so when state and metro fight, guess who is the loser? The citizens of Davidson County. So we have to figure it out. I don't think Tennessee is going to become a blue state in the next 100 years. I don't know that. But if we have to deal with, we have to be pragmatic and say, we need to approach the state in the area that they agree with, at least small business subsidies, workforce issues, infrastructure, perhaps the environment. We need to work on that. The other thing is that the relationship that we have with academia. Nashville is full of wonderful universities, like the professor comes from. There's no formal relationship to encourage and say, this is what we need to do. They have wonderful schools. They may focus one thing here and there. If you go to Baltimore, what does Johns Hopkins University do? If you go to other communities, they have wonderful universities that care about the community and focus on the community. So I think we need to encourage and say, they are doing wonderful work, small business, public health, but that's not a life-changing, community-changing effort. So that is something that needs to happen. So for us, we can continue producing the report every year, but the reality is that something has to change, what we call the Nashville way. Do you all know what Nashville way means? The spotlight, the doctor, the blind spot that the doctor spoke about. You see things, they have changed, but in your eyes, you think it's still the same. The syndrome that he talked about, all those kind of things, means we have to ask those critical questions. We don't have the space and the institutional capacity to do that. I mean, we do it in the neighborhood level, we do it in the church, but having the biggest space where we ask and say, is this the type of Nashville that we need to go? Have you guys been to Western Nashville? If you take the interstate and you want to exit Charlotte exit, and you want to go to Nashville West for business, the exit is still one lane. But if you look at the surrounding, so many thousands, hundreds of units were developed. One has to say, where is the infrastructure for all of these things? If you go to ENIAC, every school that you go has portables. Portables were supposed to be temporary. So as Jim and everybody else said, we have plenty of resources in this community. Growth has been good, but what we lacked was the institutional accountability. I can be standing here another 14 years and repeat the same data unless the culture in Nashville has to change. It has to start with Metropolitan government of Nashville to reevaluate itself and say, do we need to be a 21st century institution, or we need to be stuck in 1963. I think you all know that. I was just reminding you. Again, I would like to thank the panel, the doctors who presented today the report, and you guys, the audience who came today to hear this. I really appreciate if we can continue this conversation, but have a critical one, not just one that we say, we need to increase transportation. Yeah, we need to say it, but what type of transportation are we talking about? We need to build more housing. The doctor demonstrated, since in the last few years, housing has increased 25%, but the national population, only 9%. Where's the rest going? The other doctor demonstrated and said, Airbnb. Is that what we need? So we need to scrutinize developers and say, we need to have a purpose why we're building those kind of things. Again, I thank you so much for coming. We look forward again sharing with you many more reports. Thank you so much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.